Okay, you guys, so I'm here with Dr. Tom Giammatteo and myself, Ralph Havens, physical therapist, and some friends from Center IMT, from IMT Wellness Center in West Hartford, Connecticut. And we were just talking about some high-level people, high-level by I mean famous people, people with a lot of resources, but dealing with a really significant health challenge, very severe health challenges, the kind of stuff where nothing else really matters. You know, if you don't have your health and life is looking pretty grim, it can be tough. And what we want people to know is that things have been done to reverse these things. And so, Dr. Tom, thank you for being here. And I want to ask you, and great class this last weekend, amazing class that we were in with you. And can you name off some of the conditions? Like we've talked about certain celebrities. One that comes to mind is Michael J. Fox, you know, with that neurodegenerative disorder, and other people that have had severe stuff. And even I was talking about bone conditions in little runner girls and boys that, you know, limit their ability to run, and stuff that can be devastating to people. Can you talk a little bit about some of the types of things you've seen that that people are dealing with that we have an answer for, that the integrated manual therapy has an answer for, that it has been reversed? The medical world doesn't like to use the word healing, but we've seen people heal from things.
You know, integrative manual therapy has taken a different approach to recovery. You know, we've been teaching for over 40 years now, and I'm finally calling it structural medicine, Ralph. The structures need to be in line before the disease can come to itself. So what that means is that, you know, you can express yourself as Parkinson's, you can express yourself as a stroke, you could express yourself as a spinal cord. And Western medicine, you know, sees your disability, sees your weakness, and then gives you a chair or something to adapt to it, and never any hope to get beyond that piece. We both have a good friend named Allie D, and her story when she was 14 was she dove into a short end of the pool, crunched the bottom, and over the next month she completely became paralyzed from the belly button down. And you know, she had some hope of going to our center in San Francisco at that point. And then she came out to Connecticut, and we kept working with her, and nobody could find anything. So they actually categorized it as a psychological illness. And we did our tools, and we said, well, I think there's a little tear in your artery in your spinal cord. So let's start to work on getting blood supply back to the spinal cord. You know, in an hour and a half, she actually heard the spinal cord turn on, and she was walking out of the wheelchair. That's like a miracle.
Yeah, I mean, that's incredible, from paralyzed to walking.
Right. So, but that is the process of, you know, taking the person's story, and all the other tricks didn't work. Let's go the next step further and see what's happening. You know, that's our biggest thing, is not putting somebody in a box and saying, oh, if you have these symptoms, this is the process, this is the medication, especially when they're not working for you.
Yeah, and there's other conditions that can seem somewhat hopeless, or like long term, or you got to totally change your life. You know, I couldn't name a few, but
yeah. So the things that are hopeless in most people's worlds are a stroke or a cerebral vascular accident that leaves you paralyzed, a spinal cord injury or a traumatic brain injury, or, you know, that Western medicine was great to you know, keep you alive, but after that they don't really have any questions on how to get you back into function of life. Right?
Yeah, post-concussive syndromes.
Right.
The what's called complex regional pain syndrome, or reflex sympathetic dystrophy, that severe pain that doesn't seem to be caused by anything anymore. And
another one is Alexander syndrome. Even these ones like sort of POTS and SIBO, where even, you know, the simple problem of having a yeast and candida infection in the body. You know, people have to live on these special diets and they feel better, but never answered the process of why did you get the candida? What part of
Yeah.
your immune system really got pushed away from you to really
And
do
like the
that?
diagnosis of Epstein-Barr or Lyme, like why
Yeah.
is that affecting somebody but not somebody else? I see runners and the bone injuries in kids that train a bit too hard, I would say. But things like even simple things like Osgood-Schlatter's or osteochondritis dissecans, it's like it can be really tough on people when they can't do, and kids when they can't do what they're here to do in their sport, and especially if it's like things like stroke or head injuries or some of these interesting diagnoses like the SIBO and the Epstein-Barr. And when you talk about structural medicine, like things have been done to reverse this. One of the hallmarks of IMT is this myofascial mapping. Like you guys put your hands on Allie D, and she'd been to everybody, and she was paralyzed, and she was a young girl, and they were even starting to call it psychological problems. And you found a tear in an artery. Can you talk a little bit about like what? Like how did you do that? What are you talking about?
That's the difference between the if you don't know what you don't know, how do you know if you don't have it or not? Is step number one. We've been conditioned by billions of hours of commercials or billions of hours of listening to our healthcare professionals to say, oh, we just fix that with vaccinations and nothing else should do that. Or take an aspirin for that, or take a Tums for that, and don't really worry about the process. So we've been coaxed as a population to find the easy fix on that whole piece, right? So if you asked a carpenter if you had two pieces of wood, sticks that were going to make your next stair banner, and we hand them to you, one's pine and one's oak, you'll be able to say there's a difference in the touch of both of those. However, you probably wouldn't be able to identify the species of, is it pine or is it oak? But you give it to a fine craftsman, and they'll go, oh, that's oak and that's cedar, and that one's been aged and that one hasn't been. So it's the refinement of the skills of touch that are not even taught anymore in the medical healthcare societies. 90% of all the healthcare providers, from physical therapists to occupational, don't even get to see a human dissection of a body anymore as they're going through their healthcare pieces. They're working
Really?
on plastic mannequins. They have these anatomy tables, which you can look at, and it changes the depth of the perception, but you don't really get to touch it and hold it and feel it.
I had no idea. I mean, yeah, even I had cadaver labs.
Right.
And then one comes to mind is I was talking to some friends, and they both had chronic migraines since they were little girls, and they had tried all sorts of drugs, and now they didn't do the drugs, but they had found their right mix of things that kind of sort of kept it okay, but they were always every month dealing with migraines. And one of them said, oh, but it's genetic, it's just how it is. And I'm like, what do you say to that kind of idea? Because what do you, if they don't know, they don't know.
And the hopelessness is the hardest thing about that, Ralph, right? The best patient I like is when a mother is not satisfied with the answers that the medical community has just given her,
Yes.
right? There's a mother's knowingness that doesn't make sense, or
You know,
that's
when Ben is now a star runner, amazing, amazing runner. When he was a little guy, he had a problem where he was limping and he was dragging his leg severely. And he was tough, and he would just, but he couldn't run very well at all. And Jen and I were watching him, and I was like, this is not acceptable. We're not just gonna like let him kind of just, this is how it is. And we investigated more, and we realized he had a big gut issue, and we had to get off of dairy for a while. He was already off of gluten, but we found out that the raw milk that we were using, it started smelling funny. cleaning fluid, and we called the company here, and they had changed the cleaning people, and they had messed up, and they were putting cleaning supplies into the, what they weren't, it was cleaning solution in the milk. So we got off of all that, and we fixed him up with our hands-on stuff and treatments, and he got well again. But it was like, it would have been very easy just to, like, if you didn't know, to say, well, you know what, this is just how he is, and nobody can find anything.
Right. So it's the person that's seeking out on the internet, and hopefully they are able to catch one of your videos to spark the interest that, we can help. And I would just say, if you haven't found the answer, try not to be hopeless.
Yeah.
You're just sitting in your office today, and you had somebody coming in and say, do you do help with shoulder surgery? And the woman's expectation was, I'm going to have a surgery and I need Medicare to pay for it. And those standards are barely, like, would you want to be on welfare? Right? The
Yeah.
standards of those pieces. And you said, no, but let's talk. And she just walked out with hopelessness in that process.
And I actually have a free Thursday thing for runners and walkers, and I would have loved to have her come by and just do a little bit. And the idea is, like, can you come in on some level somehow once a month and just start to change a few things?
Right.
There's so much ways to help. Like, I know you gave an example in class of a woman who had a severe skin reaction to a bunch of stuff. And she was getting well, but she was saying, well, it's kind of expensive to keep coming in. And so you had some ways to help her. You gave her some supplements, and you committed to a certain dietary regimen, and she continued to heal. So even if somebody doesn't have the total means, or they don't think they do, even a little bit of information can help a lot, and a little bit of treatment. I want to talk to the people that do have a way to come in, though. What's I used to come out to Connecticut, and I've been to San Francisco and LA to work with you guys and to get training, but also to get treatment for me and my wife. And we 3 days of treatment, 7 hours a day. And I have clients who come to me for 20 hours over 3 days to solve chronic stuff, severe stuff. What's the deal with IMT and this 7 hours of treatment in a day and multiple days in a row, and people flying in from around the country and the world to see you and to see me for these constant things? Other treatments, you can't do 7 hours of rolfing or massage. Or talk to us about that.
Well, it's not a new concept, but this week I have somebody from Houston, Texas that's gotten 2 8-hour days, going to take a break to go down to New York tonight and then come back for another 2. And we're at 16 hours of work, and he had tinnitus for the last 6 years. So we're now touching on the edge of tinnitus and helping that hearing change in his body, right? So, some things take longer than others, and it's hard to tell where and how they are, but we try to do our best and to help people getting better and better with those pieces.
So I want to put that out there for people that, like, there's the cases of LED in one session, and she's going from paralyzed to walking, but somebody else with what seems like a smaller problem, a tinnitus, which is ringing in the ears, but taking multiple days, multiple hours to heal up. There's part of it is the commitment to fix up yourself and keep progressing in life too. Like, I like the idea of, like, I talk about the great runner Noah Lyles, and I get to work on my son Ben 3 or 4 or 5 days a week because it's just fun to work on him and improve his running. And I say, well, Noah has his physical therapist and chiropractor every week. They don't just stop working on him, and you don't stop working on your Ferrari. It gets worked on.
Right.
It's kind of like that idea as well for the people that can do that.
Yeah. So there's the ideal scene, and I've had over the years, I treat 5 generations from grandparents to newborn infants, and we help with all the spectrum of medicine through the structural medicine. So it's a way to do it without drugs and some nutrition and some body work to try to reverse things, right? So, we have this word diabetes and everybody goes on insulin and but they never stop to say, do you need to change your life? Should you change your diet? Should you really get exercise? Do you have any flexibility where the pancreas lives? All
Yeah.
those things can improve life. And we've seen those all change one way or another for that.
That's helped me when I had severe anxiety and I was first starting on the IMT world. I was eating M&Ms and drinking Coca-Cola. And I remember Reiko looked at me and said, your pancreas is just leaking. It's leaking all over your body. And I thought, how do you see that? But getting treatment and then getting off of so much sugar and changing my diet, all those things can help. So I want people to know they can get well. And some of it is just changing a few things in diet, very specific things and lifestyle. And like I've got people that have insomnia, but they insist on having their cell phone by their head in case there's an emergency. I'm like, my gosh, just turn it off at night. It can help you sleep. But so anyway, I just want this message to get out to the world because we are about healing ourselves and healing the world. And at whatever level somebody's at, you can get your health back and get on your path. You know, Sharon Giammatteo, amazing what you guys have done. And she used to say to get health, her job was to help people get healthy so they can get on their own surfboard to take their own wave. And that's what I see is like, we all have this thing we're supposed to be doing in the world and how we're supposed to be living and what we really, really want. And if you can get your health back and get on with it, that's what we're all about. So I want you to reach out to Dr. Tom. He's in West Hartford, Connecticut, IMTwellnesscenter.com. And I'll get you his phone number in a second. And I'm on the West Coast, Ralph Havens at ralphhavens.com and IMTwellnesscenter.com in the West Coast, I mean, the East Coast. And his number is 860-561-2286. I'm at 360-599-2217. Just reach out to us. I'll put posts and links on Spotify and YouTube and everywhere else this goes. And reach out to us if you're dealing with something. We've seen some big stuff, and I want to leave it with this this quote that a friend of ours said. Things have been done to reverse this, and by this I mean the chronic, hopeless kind of conditions. Dr. Tom, anything else you want to say before we?
No, just everybody be safe, and then we do have answers, but the questions, the specificity of the question, we probably have an answer for. So give us a try.
Yeah. If there's a chronic stuff, if it's genetic, if it's something, when doctors don't have answers, there is a Dr. Tom is a doctor, and I'm a physical therapist, and we might have a good answer for you. So all right, you guys, let's get out there and really live our lives. I'm going to turn this recording off.